Welcome to the Aced It podcast, where we turn science into sense. This is season 10, and in this season, we will provide 10 knowledge-packed episodes with the hopes of helping listeners understand what we can all learn from current research on overdose. It's a hard topic to discuss, but critically important information to know. So I am honored that you're with us. I'm Danielle Rudes, your host, and this is Aced It. The past 3 decades have been filled with loss and uncertainty in what will emerge. Policy responses are essential in addressing the opioid epidemic and mitigating its far-reaching impact on individuals, families, and communities. Governments at all levels play a critical role in enacting legislation and implementing regulations to curb the use of opioids, promote safe prescribing practices, and expand access to treatment and harm reduction services. This episode focuses on some of the strategies and policies that have been implemented to help curb overdose in communities. Discussing strategies and policies is vital to raising awareness, facilitating discussion and evaluations surrounding existing policies and strategies. The historical changes outlined by Dayer and colleagues in their article 2019 show that the opioid crisis in the United States has evolved gradually over several decades. Efforts to address such a complex issue through clinical, regulatory, and legislative measures have been ongoing for years, but of course, their impact is not immediate. And some interventions have inadvertently led to negative outcomes, such as an increase in illicit opioid use like heroin and synthetics. In addition to an increased challenge is managing pain effectively and responsibly. Some states have taken initiative in the promotion of change. In a review of the United States opioid epidemic, Thiessen and colleagues 2018 discussed the use of prescription drug monitoring programs, PDMPs, which have evolved significantly to tackle opioid abuse. Originally introduced in the 1930s, early versions of PDMPs only tackled certain drugs, but today, PDMPs aim to alert providers about patients receiving opioids from multiple sources. The number of programs rose from 16 states in 2001 to 49 states in 2012 due to the opioid crisis. Since then, there have been continued growing efforts in improving these monitoring programs in all implemented states. In a case study done by Penn and colleagues, 2016, they reviewed practices implemented by the state of Ohio. At one point, Ohio had the highest rate of drug overdose deaths in the United States. Policymakers in Ohio have implemented a team of several state agencies to 1. Promote the responsible use of opioids. 2. Reduce the supply of opioids. And 3. Support opioid prevention and expand access to naloxone. To reduce opioid-related overdose fatalities, in 2015, Ohio approved the distribution of naloxone without a prescription. As we often see, law enforcement and first responders are the typical people who have quick access to medications like this. Allowing for increased access to opioid reversers by the public is a big step in the right direction, giving people a chance to save other people. Each state has now enacted some type of laws pertaining to distributing naloxone. The opioid epidemic is surrounded by differing views on who should be blamed for its growth. Some argue individuals using drugs are at fault, echoing Nancy Reagan's Just Say No stance. Others believe pharmaceutical companies are at fault due to their promotion of opioids like Oxycontin. These conflicting narratives affect public opinion and policies, making it challenging to agree on effective strategies to combat the crisis. In a study conducted by Sylvester and colleagues in 2022, the authors conducted a survey for public support for a set of supportive as well as punitive policies to combat the opioid epidemic. Their study found that how people perceive the causes of addiction significantly influences their support for policies aimed at combating the opioid epidemic. Individuals who personally knew someone who had been affected by opioid use disorder or have experienced addiction themselves are more likely to support compassionate and treatment-focused policies. Their results showed a general agreement across different groups on the need for supportive policies, but supervised injection facilities face more resistance, influenced by negative stereotypes, particularly related to race. Public perceptions are incredibly important in shaping effective policy responses to the opioid crisis as we aim to bridge divides and address the social dynamics at play. Addressing the opioid epidemic requires a multifaceted approach that integrates policy, public health initiatives, and community engagement. While progress has been made through initiatives like PDMPs and expanded access to naloxone, the complexity of the crisis demands ongoing adaptation and innovation in policy responses. Efforts must continue to evolve to meet the needs of those affected, combat stigma, and ensure equitable access to effective treatment and support services. Bridging the gap between public perceptions shaped by personal experiences, ideology, and social stereotypes is essential for fostering consensus on comprehensive strategies. By harnessing collective understanding and commitment, policymakers can make meaningful change that not only addresses the immediate challenges of opioid misuse, but also builds resilient communities capable of tackling future public health crises. Thank you for listening to the ACEDIT podcast. We love hearing from you. So if you have comments, topics to suggest, or some science you'd like us to cover in a future season, please write me, Danielle Rudes at Sam Houston State University. My email is drudes@shsu.edu. And as always, thank you to the Justice Community Opioid Innovation Network, or JCOIN's Coordination and Translation Center, funded by the National Institute on Drug Abuse, housed at George Mason University, where this podcast originated. Thank you to our fabulous scriptwriters, Dr. Chelsea Narvi from Sam Houston State University and SHSU master student Jalen Magana. And a huge and a heartfelt thank you to Jason Luchin and the team at Slonky LLC for their wonderful production, as always. Tune in again soon for another episode of ACEDIT.